We've raised over 29.7 million for men's health in Ireland, thanks to the passionate community of Movember supporters in Ireland. Those critical funds have contributed to over 1,300 men's health projects worldwide, many of which are in Ireland.
Hello and welcome to another episode of the HSE Talking Health and Wellbeing podcast. My name is Fergal Fox and today we're speaking about men's health with Movember. HSE Health and Wellbeing last year launched their second National Men's Health Action Plan called Healthy Ireland Men, and much of what we're talking about today is seeking to build on the work done by a wide range of community and voluntary agencies across the country, supported by the Department of Health, the HSE and the Department of Agriculture, Food and Marine. Recently in September, Movember launched the Real Face of Men's Health report. This report highlighted that while there's been notable improvements in men's health and their life expectancy, that men in Ireland continue to die too young from largely preventable causes. The comprehensive study produced with the Men's Health Forum in Ireland and the National Centre for Men's Health in South East Technological University calls for the full rollout of the HSE National Men's Health Action Plan. So today we're speaking with Cliona Fitzpatrick, who is Movember Policy and Evidence Director. You're very welcome to the podcast, Cliona.
Thanks, Fergal. Thanks for having me.
So maybe you introduce listeners to Movember. As I said there's been a wide range of agencies working in Ireland in the area of men's health over the last 20 years. And Movember is kind of increasing its presence and footprint. And this report launch has been a really significant step for men's health in Ireland and Movember. So tell us a bit about Movember.
Yeah, look, we've been around since 2003. We were formed in Melbourne, Australia, which is where I'm calling from today. Since then, our work has been really about challenging the status quo, supporting men's health research, and it's really assisted to transform the way the health services reach, respond and retain men in healthcare. Originally, our focus was very much on prostate cancer, testicular cancer, and then later on, a bit of a focus on mental health and suicide prevention. We've raised over 29.7 million for men's health in Ireland, thanks to the passionate community of Movember supporters in Ireland, may I add. And those critical funds have contributed to over 1,300 men's health projects worldwide, many of which are in Ireland. And as a result, we've had hundreds of advancements in biomedical research and the creation of some of the world's largest prostate cancer registries, including our very own IPCOR. All this work is built on real life experiences of hundreds of thousands of men.
So a lot of men and a lot of women in Ireland would have seen the increased presence of that Movember campaign taking place near November. Tell us a bit about what people may be familiar with or have some idea about that fundraising efforts.
Yeah, absolutely. On every Movember, it's a campaign. It's all about having fun with impact. It's about galvanising individuals and communities across the country to raise vital funds for men's health. The reasoning, around it is, men's health is an issue that affects everyone. And it has ripple effects across families, workplaces and society. Every man is a son, a brother, a friend, a colleague, a partner. All of us recognise the need to strive to create a society and a health system also that's gender responsive and empowers men to reach out and seek help earlier. So you'll see a lot of community events around the country. People do epic things for Movember during the month of Movember. Supporters are obviously encouraged to grow a moustache. If you can't grow a moustache, there's many other things you can do. You can move 60k in the month or host an event. Yeah, we see some amazing fundraising events and we have some incredible ambassadors across the country.
So let's get down to the nuts and bolts of this report and some of the key headline statistics that's highlighted in relation to men's health, the call for action and the why.
Yeah.
Tell us a bit more about that.
Okay, as you said, Fergal, at face value, Ireland is doing very well compared to other countries in the EU.
Yeah.
And actually compared to other countries that we have a very strong presence in. Male life expectancy is improving. Males born in Ireland in 2023 had the 6th highest life expectancy in the EU. And they ranked 5th in terms of healthy life years. And that's years living in good health. And we're also, the first country in the world to have a men's health policy, which, back in 2009, which is just incredible. It's something to, we've really led the way internationally from a men's health perspective. But as you'd know, Fergal, if you delve just a small bit deeper than the average, it's, of no surprise to anyone that you'll uncover disparities that exist across geography, across socioeconomic background, ethnicity, and across life stages. And that's really what the report highlights. And I'll go into a bit of detail in terms of the key stats. So you'd have seen the headlines, many people would have seen the headlines, 2 in 5 men in Ireland die prematurely. And that's the average again. Men living in the most deprived 20% of areas in Ireland were on average almost 1.5 times more likely to die before the age of 75 than those in the least deprived areas. And that gap in outcomes between the more and less deprived areas is not closing over time. In some cases, it's worsening. So that's why we've highlighted that we need more focus on these areas that are in the more deprived areas of Ireland. And the other kind of key kind of headline was that 2 in 5, deaths less than 75, they're actually largely avoidable through improved screening, earlier diagnosis and treatment. The leading causes were things like cancers, cardiovascular disease, accidents and suicide. They haven't changed over the years. This actually isn't really news. We've seen this for a long time. Also, compared to women also, the leading causes are the same. It's just that men are substantially more likely to die prematurely from them. So cardiovascular disease, for example, men are 1.5 times more likely to die prematurely from cardiovascular disease and 1.7 times more likely to die from external causes, and that is things like accidents and suicide. The report really highlights screening and early detection. Bowel cancer screening was brought up in the report. It's an example of something that's underused by men, compared to women. It's just calling for that.
So there's a really wide range of issues there. You started with the headline average, but I suppose the stark issue really is the inequalities that exist. And then you mentioned loads of different topic and policy areas there that a range of our colleagues in the HSE are working to address. The challenge is significant and it remains that men are delaying maybe with their presentation or their engagement with health services. They're reluctant to engage, or that's not normalised still.
Absolutely.
Yeah.
Yeah, another positive in this report is all the solutions that are available, right? We have things that are available in the country that potentially should be looked at in terms of scaling. You've got the Pharmacy of Hearts cardiovascular health programme, you've got On Firm Ground, Corja. There's so many great examples and you'll see them throughout the report. We've highlighted them. We're calling for improved kind of early detection at that community level as well, in prevention space. So that focus on programmes that have shown impact earlier on in the prevention and meeting men where they're at, basically.
Yeah, and that's one of our key tasks in terms of the delivery of the National Men's Health Action Plan is upscaling some of the really quality programmes that's been developed and researched. It's one thing developing an evidence base around a programme. It's another thing getting it to scale across the country.
Yeah, absolutely.
As you know yourself, I know that you're working with the GAA.
That's right.
On a youth mental health initiative.
Yes, so Movember Ahead of the Game programme. It's been rolled out across GAA clubs across the country. We work with young players, parents, coaches to upskill them in terms of mental health literacy and resilience training. We've seen, impact there and also having that champion. So we have players like all-stars that are champions that champion the programme, and it's really improved the uptake of it and just the amazing partnership with the GAA. We're actually going to be hopefully evaluating the impact of it over the next year or so. So in terms of that evidence base, Fergal, hopefully we've got some great results to share with you.
We've been working with the GAA for a good few years around the Healthy Club initiative.
That's right.
And seeing that capacity going into clubs around reflecting on health and wellbeing and their potential, and then coming with a quality programme like Movember did, but having the vehicle of the GAA and having the activated volunteers, really. It's not just a GAA volunteer, you have health and wellbeing volunteers in a range of GAA clubs, so they can take that youth mental health message and put it in the place where it's most needed. We're talking about the challenges of implementation. You have an implementation system there through the GAA.
Absolutely. We've been evaluating the implementation of Ahead of the Game for years. It's taken so long. That process evaluation has taken years and years. We have been implementing it across the world and for different sports, and every single country requires a completely different implementation. So, and it's all very nuanced. So it just takes time and effort to kind of evaluate it correctly. But just going back, Fergal, to that young men, I guess that was something that was really highlighted in the report as well. We did a survey with the Irish public and half of the respondents believe that young men are growing increasingly disconnected from Irish society. So, in terms of the GAA or just meeting men where they're at, or young men knowing where to go to in terms of crisis, it's very important. The week before we launched the report, we were down at the ploughing championships. For me anyway, it was a realisation about the importance of social connection and engaging in community life, about the importance of mentoring young men and, sharing the skills, that build kind of purpose and belonging and stronger ties, across the generations. So we've also been doing, just aside from the report, the research that the Movember Institute of Men's Health has been conducting around digital platforms. Might be interesting to a lot of people in the HSE. So, something that I can share later, but it's a report we launched this year around young men in the digital world. And it talks about the impact that digital platforms and specifically masculinity influences are having on men, shaping how they kind of see themselves, and especially younger men kind of seeking identity and connection and guidance online. So there'll be a lot more work coming from Movember over the next couple of years in that area.
Yeah, that's something that we flagged in our plan as well. We named it as a healthy masculinity tools and resources for different settings.
Yeah.
Because you can see that there's different age groups of young men and parents.
That's right.
Like the parents are crying out for more as well. And I know that earlier this year, the Netflix series Adolescence went viral in terms of its reaction or people's concern that things can happen and you just don't see them and they're just right beside you. One of our podcasts actually for Men's Health Week this year was with Conor Hammersley.
That's right.
And about different elements of healthy masculinity. And it's definitely something that there's so much more work needed on. So it's good that you've got some evidence to bring to the table or some research to know how we can get at that, because I can see some of it emerging organically as well in terms of champions for men's health and new voices for men's health. And I know in one of your recent launches of the Movember campaign in Ireland, you had some campaigners or some high profile people speaking about the importance of talking about men's health and the importance of men's health even talking about anything, as you said, like social connection. I'm sure if you haven't been at the ploughing match recently, you saw how many young men and women, but it's just an avalanche of young people at the ploughing match.
I couldn't believe it, actually. Yeah.
Yeah. It's great that you were there.
Yeah, and the amount of young men that came into us and were like, asking about their mental health and actually, about having friends that they're worried about, and just very, like, in terms of their mental health literacy, it was just like so shocking. I'm such, in a positive way, like they're very aware. And so it's just building on that, isn't it, really?
Yeah, that's great.
And the other thing around the masculinities, I guess sometimes masculinity is thought of in a negative way in terms of toxic masculinity or those kind of traditional norms. Sometimes they're thought negatively, but Movember is doing a lot of work in terms of positive or healthy masculinities and really defining them. One of our key authors on the report, Dr. Noel Richardson from SETU, he wrote a piece on what it means to be a man in today's society in Ireland that I thought was really impactful. If you get a chance to read the report, it would be great to have a look at, because it really talked about the changes in the role of men, over time. So it's something that should be focused on.
Yeah, Noel is a fantastic voice and leader for men's health for many years in Ireland. Actually, in one of our first podcasts, he shared very personal information about his own journey.
Oh, very good.
So if you go back to the early episodes, I think it's episode 4 or 5 with Noel.
Yeah.
Because he just gives so much insight from his own men's health journey. And then he's seen the transformation in some ways of so many allies, but still needing leadership and needed work.
Yeah. Absolutely.
So just to kind of come back to the report,
because
you mentioned Noel's piece in that, and I know he was heavily involved across the report, but there were so many different research components in the report.
Yes, so many. Sorry, there's too many to even talk to when the report launched. Yeah.
Well, I thought that was a challenge in communicating it. You could have done 4 or 5 different report launches.
Yeah.
Because there was 4 unique pieces of research done, and they were all very significant.
Yeah.
And I want you to speak about, like we talk about allies and gatekeepers and signposters in the health and wellbeing space. But GPs, you did a study specifically with GPs. Tell us about that, because I think that's very interesting what they said about men's health and what we need to do to support GPs to support men's health.
Yeah, and look, just to add, this is just the start. There's a lot more research that we need to do, but it was just to kind of get that GP voice in there, especially as we were talking about gender responsive health systems. So Just some of the key findings, GP cited stigma and social norms around self-reliance and kind of a lack of support networks and fear of career impact. Loads of things like that as key reasons why men are reluctant to seek help for their mental health specifically. And it's no news to you, Fergal, in terms of, 4 out of every 5 deaths by suicide in Ireland are male. But only 14% of GPs were very confident in working with men experiencing suicidal behaviour. So that was kind of a stark finding.
No, yeah, that is so stark.
Yeah.
A number of people work in health are aware, obviously, the concerns around suicide.
Yeah.
But the concerns about men's health in that realm of suicide, mental health harm and self-harm, it's just, it can't be any more stark. It's just really, really shocking. There's no time I see that statistic and I'm going, isn't that absolutely just, it's just ridiculous.
They talk about the health system, in terms of like what the prominent issues reported, in working with men or males presenting with suicidal behaviour. They talk about access to quality mental health services and just limited, honest kind of communication from male patients. And then they mention around a lack of crisis supports. But as I said, this is just an initial piece of research. We need to do more, more research to really unpack it all and understand it more.
Yeah. And just to highlight in relation to that, like in fairness, like it is fantastic to get the GP voice.
Yes.
But during the summer, I think it was, or just late summer, that the Minister Butler announced new supports for men's health in terms of counselling and trying to get some of that access. I see our mental health colleagues and some of my communication colleagues trying to get that message out to men.
Yes.
That, counselling is a really valid and supportive thing that they can access. There's free counselling available.
Yeah.
That has been increased significantly through a ministerial direction during the summer. So that was welcome, and more supports into that area need to go to address the likes of that GP concern. What can I get the man that comes into my GP surgery to do? What can I get him to support himself with?
Yeah, because there's no issues with them engaging initially. It's more the drop-off is huge. And we see that in other countries and we call for it in the report, but really just gaining an understanding of men's engagement with the health system or the mental health system even. When they do engage, they tend to drop off. What are the issues there? Kind of understanding the experiences of men more. And we have a programme, there's obviously Engage, which is this practitioners trying to build those effective relationships with males. But also Movember has a programme called Men in Mind. Now it's not ran in Ireland yet, but it's something of interest potentially, that equips kind of healthcare professionals with the confidence to engage men more effectively. So there's solutions out there as well for that.
Yeah, that's definitely something that we've been trying to do.
Fantastic.
On the back of our new action plan, we have a new programme lead. Dr. Shane O'Donnell is just after taking up post there just over a month ago.
That's right.
In leading out on that action plan. But trying to support people and give that capacity, as you said there, to engage men, that you're thinking about men. You have an understanding of how the challenge might be a bit different here. And there's a risk that if I don't put my thinking cap on, that they may not engage or they may disengage early.
Absolutely.
Yeah.
We say it's about reaching, responding and retaining men in the healthcare system. So ensuring that their experience with the healthcare system is something that they're comfortable with. And it's also about making sure that it's practical as well. We're all working and sometimes it's just hard to get to the GP or the counsellor or whatever it is. We talk a lot about going to where men are, and that's where community setting comes in.
Yeah, you've mentioned that before, and I think that's something that Noel Richardson would say as well, like the community-based health promotion. It is really, really golden time for men. If you can get them there and they look around and they see men like themselves putting their hand up for support or even getting social support without it being named.
Absolutely.
I think a lot of men get social support, as you said there, from the GA. They don't come into the GA here and put my hand up for social support. But you're de facto getting massive social support. Even if you're not playing, you're involved in a committee, be it soccer, rugby or any community, there's massive health promotion going on by community organisations and even voluntary organisations that are just convening for a completely different purpose.
Absolutely. Volunteering, just in general.
Volunteering itself, sure. Yeah, 100%.
And men's sheds.
Yes.
And my first job was actually work experience years ago with CRE, the West of Ireland Cardiology Foundation. And, going to the mart and doing health checks in the mart. I'll never forget it. The queue of farmers waiting to get a health check was just unbelievable. That stuff sticks with you.
It does, of course. Yeah, you've gone to where they were at.
Yeah. And the follow-up after.
Yeah, the follow-up is vital. And I know you mentioned the Farmers of Heart's cardiovascular program earlier.
Yeah.
And I referenced the Department of Agriculture, who have definitely increased their footprint and their funding to a range of groups trying to support farmers' health and safety specifically, but also health and well-being.
Yeah.
The mental health supports. And we've seen an increase of the likes of the Irish Heart Foundation and CRE and others targeting men literally at the marts, like you were saying there in your work experience.
Absolutely.
There's nothing more pure than meeting that line of farmers and getting their insights from where they're at.
Yeah.
So, I can appreciate how that'd stick with you all those years.
Absolutely.
So coming back to one of the pieces that you had in the report, the impact on families and carers, you're making a case that men's health isn't just about men.
Yeah.
Like it's foolish to think about it's a men's only issue.
Yeah.
Tell us a bit about that.
Yeah. So we talk about the ripple effect of men's health on others.
Yeah.
Thinking, a father, a son, a brother. So in Movember, we conducted another piece of research with 802 informal caregivers, and they are kind of family and friends and partners of men who support men with physical and or mental health conditions. The findings talk about the emotional and psychological and physical strain that predominantly females, it was 68% females who responded to the survey, that they experience, and just a general lower life satisfaction they have. And also the most commonly reported negative experiences was that kind of persistent worry or anxiety and just feeling stressed or emotionally kind of overwhelmed, low mood, difficulty coping. The impact it's having on the informal caregiver is substantial. And then the access to kind of formal and informal mental supports obviously plays a massive role. We had a look at kind of the structural barriers, and those who are more supported were less likely, obviously, to feel negative impacts. But just on the flip side of all that, there was also positive things in terms of the caregivers having a great sense of communication, and it can have a positive effect on relationships as well. It depends on the intensity level of the caregiving, basically.
But it's highlighting that men's health and women's health and family health, they're all knotted into one.
Absolutely.
I remember speaking to a local men's sheds here, it was in Westmeath actually, and the leader of the shed said that he was contacted by one of their members passed away. They went through an illness and he passed away. But the mother and the daughter, like around the time of the month's mind mass, they came to visit the shed and they just sat down with the men in the shed and they said, "You have no idea what help you gave our man."
Jeez.
Not just through his sickness, but through his life. You know what I mean?
Yeah.
Like if it enriched his life, like supported him.
Absolutely. Oh.
So I just thought, isn't that unbelievable? It's about community-based peace, the men's sheds working nationally, the volunteers working locally.
Yeah.
And the family feeling, wow, their heart is breaking, but they're making, like, it's such a beautiful piece. I thought that they just kind of captured it so perfectly that men's health isn't about just the men.
That's right.
We want to support each other.
Yeah.
And sometimes in retirement, I feel that men in a family dynamic, or the man and the woman, the traditional relationship, they have to refigure themselves. And if the man doesn't have an outlet or a thing to do, that becomes a big challenge in that transition.
That's right. Yeah. We talk a lot about Movember, in Movember, about nurturing friendships and, again, building that sense of belonging is so important. It's so vital. I know my own father, he continues to do that as his life changes throughout the different life stages. And you lose a lot of friends along the way, unfortunately, but it's about nurturing the ones you have and continuing that connection, and also mentoring younger men. They really need it right now. As we said, there's a lot of young men seeking identity. Getting that connection with the older generations is vital right now.
Yeah, that's a good way to put it out. We need to model pro-social modelling for men and young men. That's a good way to think about it.
Yeah.
In terms of the future and Movember's presence in Ireland, how do you see that in 2026? And what's your hopes for the future now? You kind of made a big bang with this report.
Yeah.
You've got loads of people talking about men's health, which is fantastic. Like you're really, really amped up the discourse.
Yeah.
So what's the hopes for the future?
I'm obviously in the policy and advocacy space, and we're very new to policy and advocacy in Ireland.
Yeah.
The Movember Men's Health Institute launched 2 years ago, And that's basically a research and policy vehicle for men's health. And we launched the report, and the next step, it was a big, broad report that focused on a lot. Our next kind of step is now to focus in on specific subset issues or different life stages. We're really interested in funding the evidence building of programs. And a big part of what we're asking for is to commit to a long-term partnership with the Irish government to tackle the complex issues that we've discussed today.
Yeah, that could be a game changer, because more and more government departments are seeing their role in health and well-being, and then men's health is such a broad myriad of issues, like we've mentioned, that you've mentioned screen, and you've mentioned suicide, mental health, engagement with the health service. You've touched on loads of different things, stigma. There's such a wide range of issues to be addressed here.
This is just the start, Fergal, really. Like we've done with everything, our work revolves around collaboration and partnership with other men's health organisations and other, health organisations like heart, mental health, whatever it is. So just moving on to what we had called for is bringing it back to the National Men's Health Action Plan.
One of the projects that we're working on, we had a positive mental health programme called Minding Your Wellbeing, and we're trying to reorientate it for men in the workplace and trying to give something of value and something that so many workplaces are, very high percentage of men. It's a target-rich environment when you can go there with a clear message and a clear support for men's health. There's exciting opportunities out there, I think, and that we're looking forward to working with the likes of yourselves and others on them. So, it's good to have another high-profile partner on the pitch to work with us around that.
That work was fantastic, and it's just about recognising that. That's what we're calling for, and to invest in the work that has already been outlined. So commissioning that full cost analysis of the National Men's Health Action Plan in terms of that resourcing and implementation of the action plan and action plans for the future. It's not just 2024, 2028. It's about, what do the future action plans look like? Working with yourself and the team now to prioritise the development of a cross-government policy statement on men's health. Outside of health, when you think about, I'm just going to say it again, meeting men, boys, where they are, it's like, the agricultural setting or the work setting, you can just go on and on,
In terms of a call to action for people tuning in today, if you're a man tuning into the podcast, or you're somebody working in the health service, or somebody working in a community level, or you're volunteering in some way, have that conversation. And if you want support around that, I'd encourage you to we'll put the link up to the Movember report and link to their website. We'll also link to the HSE supports on men's mental health that I referenced earlier on, and I'll highlight a link to our National Men's Health Action Plan as well that we've been talking about. Cliona, before we finish with you, can I ask you a bit about your personal work journey? You're down in Australia.
Yes, I am, yeah.
But you're not from Australia, obviously. So if you started with the farmers with Cree in the west of Ireland, how did you get down to Australia?
So I'm from West Clare originally, farming country. So my dad's a farmer. So I've always been interested in rural health. My background of a degree in nutritional sciences from UCC, and then health promotion, like yourself, Fergal.
We crossed paths there.
Yeah.
Okay.
And that's where I did my work placement, actually. So
good stuff.
I've had a big interest in men's health for a long time. I spent over 11 years at the Heart Foundation in Australia. I was director of data and evaluation there. So I'm big into evaluation of programs, and I learned a lot when we did that health promotion masters. It taught me a lot about evaluation effectiveness. I've been using it ever since. So
Margaret Barry would be proud of you.
That's right. All those essays we had to write came to good use.
So you spent a good few years with the Heart Foundation.
That's right.
Okay.
And I moved across to Movember then about 4 years. So I've been in Australia about 15 years now.
Wow.
And it's been great. I work across 6 countries. So Ireland is one of my core countries.
It must be an unusual novelty to arrive home to work.
Yeah.
I met you in Dublin before the report launched, and I thought, she's based in Australia and she's over here launching a report in Ireland. That's unusual, isn't it?
Yeah. Now, in fairness, we'd worked for over a year on that report. So my hours were all over the place.
Yeah.
But I absolutely loved it because, it just felt very relevant to me, my upbringing. I could connect to it much easier than other countries. So, but look, we've seen very similar results across the world. So it's not just an Irish issue. The same issue happens everywhere. I have to say there's some great solutions in Ireland, and we should be very proud of that. And the whole purpose of Movember is really to collaborate and convene across the world. If you talk to anyone who we fund, they'll say that's one of the big benefits of Movember, is kind of understanding what's going on in, for example, what's happening in Ireland versus what's happening in Australia, and how can we learn from one another. The same issues lie, and we have different solutions all over the world. So yeah, I'd say that's been one of the most exciting parts of working for Movember over the years.
Okay, well, that's nice. Thanks for sharing that. So look, we'll leave it there. Thank you very much for joining us, Cliona. And thanks to the listeners for tuning in to the podcast. If you want any more information, as I said there, we'll put the links in the podcast information that relate to this episode. And if you want to get in touch with us at the podcast, you can email us at healthandwellbeing.communications@hse.ie. And you can check out our other channels on LinkedIn, X, our YouTube channel. And thanks for tuning in to another episode of the HSE Talking Health and Wellbeing podcast.